If you haven't been to the doctor recently, well, you need to get back in there. And I'm going to give you a few tips on some special screening tests that you might qualify for, that you might need. Guys, I'm Dr. Jen. I'm your friendly family doctor, and I love talking about this type of stuff. I'm giving you literally, oh, and by the way, I want you to have pencil and paper ready because I want you to jot down some of these things. This is for men and women, by the way. I'm giving you cancer screenings and a few other tests that are going to be very, very, very important for your health. And back to the family doctor part. This is one of the reasons why I became a family doctor. I love this stuff. I love prevention. Okay, don't get don't get me started on why I love my job because there are so many reasons why I love my job. Anyway, guys, why don't we get started? Oh, by the way, yes, I'm a family doc. I'm a practicing family doctor, an on-air health expert, and a video creator. Thanks for being here. Okay, we're going to start with women, but men, hang in there. Don't go anywhere because you're going to be right after the women, okay? So women, let's get started. You got your pencil and paper ready? I hope so. First, a cancer screening test I want to make sure that you are getting is the mammogram. You say, why do I need a mammogram? Well, mammograms are for breast cancer screening. This is so important because we know that if we find things like breast cancer early, sometimes they are more treatable and more easily treatable. Guys, so important. According to the U.S. Preventative Services Task Force, we should be getting our mammograms starting at the age of 50. However, other organizations do recommend starting your mammogram screenings at the age of 40. So you say, when do I start then? Well, this is where you need to talk to your doctor, okay? Find out what your doctor wants you to do. I generally start them at the age of 40, but your doctor may recommend something otherwise. And remember, all of the screening tests, the cancer screening tests I'm talking about today, have to do with people who are of average risk. Meaning, if you have a predisposition to the cancer I'm talking about, or you've had this cancer, you have a family history or things like that, these recommendations do not necessarily apply for you. I'm talking about somebody of average risk. Okay, that's the mammogram, okay? Ladies, next thing to put on your list is the pap smear. Why do we get pap smears, you say? Well, because they screen for cervical cancer. This is so important as well. Remember, early detection is the key. So, according to the U.S. Preventative Services Task Force, cervical cancer screening should begin at the age of 21. Other organizations do recommend different ages, but 21 is their recommendation. Guys, again, this is for people of average risk. Okay, moving on. This is the colonoscopy. And by the way, men, you can listen here. You can perk up a little bit here too. Actually, I hope you're perking up throughout the whole thing, even though we haven't specifically talked about men yet, because we know you have women in your lives, right? So very important. But colonoscopies are for both men and women. Guys, I told you recently in a video I did that colon cancer screening ages have changed. The recommended age to start is now at 45. It's not wrong if you get it starting at 50. We definitely want screening to start by 50, but 45 is also an option. That is an option I am recommending to my patients. We know that there are a certain number of people with colon cancer that get it before the age of 50, so we want to catch that early. Colonoscopy screen for I said scream, screen for colon cancer, but there are other screening tests as well that you might qualify for. Make sure that you start by the age of 50, but I recommend 45 as well as the U.S. Preventative Services Task Force and many other organizations as well. Again, this is for people of average risk. So if you have polyps, if you have a family history, if you have personal history of inflammatory bowel disease, other things, this does not apply to you, okay? And by the way, the colonoscopy or colon cancer screening is for men and women. All right, women, we're moving to the, let's see, 1, 2, 3, 4. The fourth thing, fourth thing that you should be writing down on your list, and by the way, men, keep perking up, stay perked up because this applies to you too, is the low-dose CAT scan of the lung. You say, what is that for? Low-dose CAT scan of the lung is to screen for lung cancer. Whoop, whoop, blah, blah. We didn't have this screening test, or at least it wasn't a recommendation when I was in med school and even a young attending, to be honest with you. This is new in the last, I don't know, gosh, 6, 7, 8 years-ish or so. And boy, am I thankful for that. Oh, so first of all, let's talk about smoking, okay? Want you all to quit smoking if you do. Maybe I'll do a video on that. But whether you do smoke now or have smoked in the past, you may qualify for lung cancer screening. This is through a low dose CAT scan of the lung. Generally, this is for people ages 50 to 80, people who have smoked at least the average of 1 pack a day for 20 years, and who currently smoke or have quit smoking within the last 15 years. Guys, this is for both men and women. Make sure that you talk to your doctor about this possibility if you qualify for this. And again, I'm not giving all the details of these screening tests. I'm just sort of giving you the highlight reel, okay? So that's why you're taking notes, so you can go talk to your doctor about, you say, this woman named Dr. Jan said I need to, do I need to, okay, well, you can say that or not, but the idea is talk to your doctor about what you should get. Okay, women, one more thing, women, I want you to write down on your notepad, okay? That is the DEXA scan. That is a bone density test. Now, this is not a test for cancer. It's not a cancer screening test. It's actually to test your bone density and to screen you for osteoporosis, which again is not cancer, but it's a very important screening tool and test that we have. You should begin these according to the U.S. Preventative Services Task Force at the age of 65. Some people need to start them earlier if you have risk factors, okay, for osteoporosis. So, guys, super important. Ladies, that is a quick list. Let's see, 1, 2, 3, 4, 5 things should be on your list to make sure you talk to your doctor about. Men, it is your turn next. Let's just jump in. And you guys, you guys have a shorter list, I have to say. So remember, men, we talked about the colonoscopy already and the low dose CAT scan of the lung. That applies to you too. Colonoscopy screening, or rather colon cancer screening, should start around the age of 45, certainly by the age of 50. These are for people of average risk. Low dose CAT scan of the lung for lung cancer screening. If you smoke now or have smoked, I mentioned the criteria when we were talking about the ladies. So put that on your list. Those two things should be on your list, men. Okay, next thing is prostate cancer screening. You say, what about the prostate? Well, the U.S. Preventative Services Task Force gives this a grade C recommendation. So it's a little bit below the grade A and B. What this means for prostate cancer screening is that this is an individualized decision that should be made with you and your doctor, okay? Generally, screening can start around the age of 55 to 69. But again, talk to your doctor about the risks and benefits because there are both, okay? So that is really important to keep in mind. Prostate cancer, that you want to have a discussion with your doctor. If you have a family history, risk factors for prostate cancer, this does not necessarily apply to you. You should be doing something different, is my point. But this is for people of average risk also. And then the last test I have for men, see, I told you your list was a little shorter. So you should have 4 things on your list, is the AAA screen. You say, what is a AAA? Abdominal aortic aneurysm is what AAA stands for. A. And there is a screening test for men ages 65 to 75 who have ever smoked. You should get an ultrasound of your abdominal aorta to screen for an aneurysm, guys. This is really important. So again, men age 65 to 75 who have ever smoked should get an abdominal aortic aneurysm screen, which is an abdominal aortic ultrasound. Gosh, say that 3 times fast to screen for an aneurysm. Okay, that's for men who have ever smoked. Guys, I hope that's helpful. Remember, take your list to your doctor and say, this woman named Dr. Jen on the internet, internet, was telling you that you might need these tests. Make sure that your doctor talks with you about them, that you get your screening tests, because our goal is to stay healthy. That's what we do, right? That's what we want to do. Guys, I'm Dr. Jen Caudle. It's so great to be with you. It's such a blessing, by the way. I love what I do, seeing patients, and I love chatting with you guys. And hopefully this is making a difference, okay? Guys, I'm Dr. Jen Caudle. Thank you so much for watching this video. If you have not subscribed to my channel, I invite you to do so. Please click the little bell to get updates. Also, please share this video with other people as well. I'm Dr. Jen. I will be back very soon.